welcome to Nursing with Professor B. My name is Bridget, I'm a family nurse practitioner. In today's video, I will be going over common medical abbreviations, the letter A. Common medical abbreviations, the letter A. So the first one that we will see is AA, could be Alcoholics Anonymous, especially if you're in your mental health semester, or it could also mean the ascending aorta. This is why I always say that it's very important that whenever possible, actually write out what you mean instead of abbreviating, because even though it's important for you to know these abbreviations because you will be tested on them and you'll see them in charts, they could mean different things. So in order to prevent confusion or misunderstandings, it's always better to write things out. A AAA or an AAA is an abdominal aortic aneurysm. And this is life-threatening. And this is life-threatening if it ruptures. It usually occurs in white males with a history of smoking. ABD is abdomen or abdominal. ABG is arterial blood gas. You definitely will see that a lot. ABN is abnormal. A lot of places are now having you chart by exception. So you don't chart what's WNL, which means within normal limits. You chart what's ABN, which is abnormal. If you're struggling in nursing school and you don't know how to take nursing style tests, then I'm extremely excited to let you know that I did create a course. It's called Nursing Test Secrets, NCLEX-Test Taking Strategies. It was designed for the student that is struggling with NCLEX style tests or nursing tests. This course is designed to give you an edge, whether it's on the NCLEX or if you're just beginning. It has videos for those that are auditory and visual, and it also has PowerPoint included. ABP is your arterial blood pressure, and AC is before meals. So if you see that on your MAR, like example level thyroxine, you definitely need to give this before meals. You may see AC with that. In Spanish, before meals is like before eating is antes de comer. So it works out like that if you speak Spanish. And I'm sure it's derived from Latin, but I don't know the Latin off the top of my head. ACTH is adrenocorticotropic hormone, and it's a hormone produced by the anterior pituitary. And ACTH regulates cortisol and androgen production, and diseases associated with ACTH include Addison's disease, Cushing's syndrome, and Cushing disease. Ad lib is as desired. You can also think of it as like at liberty. So as desired or ad lib, patient may get out of bed at ad lib. ADH is antidiuretic hormone, and this hormone regulates and balances the amount of water in your blood. If it helps you think about it, so when you diurese something, you get water out, right? Diuretics are the water pills. So if you're anti-diuresis, you're conserving water. So that's how you can remember that ADH conserves water. It's antidiuretic hormone, and it constantly regulates and balances the amount of water in your blood. We'll see ADLs a lot. Those are activities of daily living. AKA is above the knee amputation. Something that I wanted to mention is one time I was working and it was not mentioned in report that this patient was an amputee, and they had been charting on him for like 3 days, a 2+ dorsalis pedis. And when I went to go do my head to toe on him, he had a unilateral above the knee amputation, or AKA. Obviously, his dorsalis pedis pulse was not there. So all this to say is that don't copy and paste another nurse's chart. You can copy and paste your own charting if nothing has changed from the morning, but don't just copy another nurse's charting. That's illegal and it could get you in trouble. ALL is acute lymphocytic leukemia, and it's the most common kind of childhood cancer. AIDS is acquired immunodeficiency syndrome. AK is above the knee or above knee. AM is morning. AMA is against medical advice. If your patient wants to leave for whatever reason, it's within their right. They can leave, but make sure that they sign that document. It protects you and the hospital and the physicians. Basically, it says that if they leave against medical advice, and it lists everything that could potentially happen, including death. So cover your behind and make sure that they sign this document before they leave. One thing I want to say about the AMA is that when I was a nurse, it was kind of like a myth that would go around that all the nurses would tell patients like, oh, if you leave AMA, your insurance won't cover your visit. That's actually not true. There was a recent CBL that came out, and insurance will still cover their visit even if they left AMA. AMB is ambulatory. AML is acute myelogenous monocytic leukemia. Usually occurs in older adults, and that's why I have this gentleman here. AMP is ampicillin or amputation. AMT is amount, and ANS is autonomic nervous system. A and O is alert and oriented. A and O is alert and oriented. Some facilities have A and O times 3, others have A and O times 4, which is alert to person, place, time, and situation. Just chart whatever your facility wants. AODA is alcohol and other drug abuse. A and P could be anatomy and physiology or auscultation and percussion. API is appendectomy. AQ is an aqueous solution. That word is really hard for me to say. ARC could be AIDS-related complex or American Red Cross. ARDS is acute respiratory distress syndrome. ASA is aspirin. So if you see, for example, on a chart that their allergy is ASA, that means that it's aspirin and aspirin-containing products. ASAP, I'm sure you know this one. It's as soon as possible. ASL is American Sign Language. So fun fact, sign language, that's why it's called American Sign Language. Sign language is not universal. I actually have a cousin in Colombia and he is deaf. And I know a little bit of American Sign Language, but unfortunately, I don't know any Colombian Sign Language. So it definitely is a barrier in language, even among sign language. AV is atrioventricular. AVR is aortic valve replacement. A and W is alive and well. Drop a comment below. Let me know what semester you're in, whether it's LPN school, nursing school, CNA school, how that's going. And again, make sure you check out my course. It definitely will give you an edge on nursing tests. All right, if you like this video, make sure you hit the like button, make sure you subscribe, and make sure you turn on that notification bell.